Hello and welcome to this COVID-19 update for Friday, March 19, 2021. I am Gabriela Patram. With me is the Minister of Health, the Honorable Dr. Frank Anthony. Minister, thank you very much for joining us today. Getting right into it, yesterday's dashboard would have stated 120 new cases. Apart from that, though, during this week we would have seen a steady increase in cases. Can you say this is due to more testing being done, and also with the hotspot areas, how are those being monitored?
Well, first of all, thank you very much for having me on the program. And as you rightly said, we have seen an upward trend, more cases. As of today, we would have had close to 884 active cases. And today, we have seen about 46 new cases that we detected over the last 24 hours. So we have seen an overall increase of cases over the last 2 weeks. And we can attribute it to a number of factors. One can be the increase of testing that we're doing. When that 120 cases that you quoted was recorded, we had more than 1,000 tests that were done. So the more you test, the more cases you would find. And I think that's one of the phenomena that we're seeing. Today we had close to 900 tests that were done. So when you look at the amount of tests, obviously we are seeing more cases being captured with all these tests that are being done. To date, while overall we have maybe about 9,600 and something cases, we have done 81,000 tests. So as you can see, we have increased the amount of testing, and because we have increased the testing, we are able to detect more. In terms of hotspots, most of the places are generally or relatively quiet, but we have seen with the increases of cases that we've been getting, we are seeing most of that increase occurring in Region 4. So we have right now close to 420 active cases in Region 4. And in Region 4, in the area of Diamond, we have seen a number of cases in Diamond, a cluster of cases in Diamond. And we have also seen a cluster of cases in Kitty. So these are two areas that we are monitoring because of these clusters that we have identified. The next region that is on our radar is really in Region 3, where we have seen a number of cases there as well. But their cases are more diffuse with one or two cases in different areas, and that's nevertheless we are looking at it because as an aggregate, in Region 3 we have seen quite a number of cases. So we continue to monitor and to be able, once we identify positive people, to be able to isolate them so they reduce their contact with other persons and reduce the chances of them getting or spreading the infection.
Would we have a need, or would have had a need during this week or so, to send any more samples to CARPA?
We have an arrangement with CARPA. We had sent the first 10 samples. We received those results back. There wasn't anything alarming in those results. And shortly thereafter, they suspended the arrangements. We're now told that they would be accepting more samples again. So we'll be putting together samples and sending it to them.
Minister, if we can talk a little bit about the vaccine rollout. Could you tell us how many have we vaccinated to date? And have there been any severe side effects or reactions to the vaccines?
So to date, we have done 15,524 immunization across the country. I think it's going well. I think more and more people are coming out. We have some areas where we can improve it. One such area is in Linden, where I think we need to get more of the community out, and we need people of influence in Linden to advocate for the vaccine, because as we know, once you're immunized, it protects you from getting the more severe form of COVID. We have had persons from Region 10 who would have gotten infected um, prior to this rollout of vaccines. And in some cases, they had the most severe form of COVID, and we had a few deaths as a result. Now, we can prevent all of this if people take the vaccine. So, one of the things that we'll have to do, we got to engage more of the persons of influence in Linden, and hopefully we'll see a better uptake of the vaccine. But outside of that, you know, many persons are coming forward to take the vaccine, and we are very pleased with that. We'll be ramping up the rollout because we want as much people as possible and in the fastest way possible to get this, because once they get the vaccine, that protection starts, and we are eager to put these vaccines in people's arms rather than keeping it in one of the freezers that we have. So that's very, very important to us.
Minister, can you say which categories will be considered in the next rollout phase for the COVID-19 vaccine?
So once we complete this first phase that we're doing, which would include the healthcare workers, both in the public and private sector, and persons 60 years and above, once we complete that, our next level is to go to those who would be maybe 50 years and above, and then we'll drop subsequently. But we still have quite a number of the 60 and above to reach, and while we have fixed sites, we understand that people have some challenges in getting to those sites. So we are now working with many of the NDCs to get them to identify the older people in the NDC, and those who are bedridden and so forth. We'll have special teams that would reach out to them and be able to take the vaccine to them because they can't move. Those who can come, we'll be moving. We'll have roving team that would go to these villages. We'll announce when we're coming so that people can come out and get their vaccine in the area. More than likely, we'll be using the health centers, and where there isn't a health center, we'll try to find another suitable public building that we can utilize.
The European Union medicines regulator has concluded that the Oxford AstraZeneca, I hope I pronounced that correctly, COVID-19 vaccine is safe to use after several EU countries suspended their rollouts following reports that it could be linked to blood clots. Just for reassurances purposes for the Guyanese public, can you explain the stages of careful testing, or also known as clinical trials, that all vaccines go through to test to verify the effectiveness before it goes to a country or administered to someone?
So all of these vaccines and this one in particular, the AstraZeneca vaccine, has gone through very rigid clinical trials in several countries. The United Kingdom being one of those countries where these clinical trials were conducted, and having gone through first phase, second phase, and a third phase clinical trial, all the data was then compiled, and various regulatory agencies, independent of the people who did those clinical trials, these regulatory agencies were able to assess the data from the trials, and they have all concluded that it's safe to use the vaccine. Based on the analysis that they have done, that's why they have given the emergency use authorization for the use of the vaccine. So with AstraZeneca, the United Kingdom has given the go-ahead for emergency use authorization of the vaccine. And then subsequently, the European Union did the same thing. India has also granted emergency use authorization, and pretty much a lot of the countries around the world have done the same. AstraZeneca, the current issue that has arisen is that in the European Union, in a few countries, they have found that a few people having received the AstraZeneca vaccine, within receiving the vaccine to up to maybe 14 days after, that some of these people develop a clotting disorder. Now, in one instance, there were 7 cases. In another instance, they had a few other cases of different type of clotting disorder. And they felt that somehow getting the vaccine and clotting disorder, maybe the two has been somehow associated. The reality, though, is that clotting disorder, if you take the vaccinated group and those who have not received the vaccine, in the vaccinated group, the clotting disorder is far less, right, than in the non-vaccinated group, which has more clotting disorder. And therefore, they couldn't make that causal linkage between the two. And so, while it's important that we investigate every adverse event that has been identified, and that is what the European regulatory authority is doing, they have taken a pause. Some of these countries, which is their right, they took a pause. And many of them now, having reviewed back the data, having consulted with their experts, have now resumed giving the AstraZeneca vaccine. So we expect that this would continue, the rollout of this vaccine. In the UK, more than, I think, 14 million people would have received the vaccine. They haven't recorded any adverse event with clotting disorders. In the European Union, they recorded these, and that's why they had a pause in a few countries. Some of those countries have since started back their vaccination program. The World Health Organization, they have an expert group called SAGE, and the SAGE has reviewed the AstraZeneca vaccine and has given its go-ahead for its use. And again, like with everything else, they would continue to monitor to see if there are cases that are coming up and to review those cases to see whether there's an association between vaccination and any disorder that would come up from time to time. And once they do that, and if there's a connection, obviously they will publicize that, and they'll make sure that it's safe to use, or if it's unsafe to use, then they will say so, and then you stop the use. But as of now, the WHO, the European Regulatory Authority, the UK body, where a lot of these vaccines have been used, have all said that the benefits of receiving the AstraZeneca vaccine outweighs whatever side effects that they might have. And what we're talking about, maybe just to put it in context, is a couple cases with adverse, well, we don't know if it's adverse event due to the vaccine, but there are a couple cases of clotting disorders and millions of people who have received the vaccination, right? So again, we here, we have our pharmacovigilance committee, and we have been monitoring. What we have found is that we haven't had any case of extreme adverse reaction. However, we do have persons who would have side effects. These would normally go away within a 24-hour period. And we have been monitoring those side effects, and from what we have seen, the predominant side effects would have been things like headache, a little bit of fatigue. Some people get pain at the site of the injection. Others would have chills. Others would have fever. Those are the general side effects that we are seeing. And but within a 24 hours, those would go, and people would feel much better and carry on with their business.
Thank you, Minister, for that reassurance and clarification. President Dr. Mohammed Irfan Ali would have recently stated or announced that Guyana has ordered vaccines from Russia. Could we get an update on that, and probably if you can say the amount to be received through the COVAX mechanism as well?
So we, as you know, we want to immunize a substantial part of our population this year. And if we're going to do so, we have to source vaccines. We have been using the AstraZeneca, as we spoke about just a few minutes ago, and we are expecting to get additional doses of AstraZeneca vaccines from COVAX. They have promised us to send us 100,800 doses. We should get some information maybe sometime today or maybe early next week when those doses are going to be coming, how many would come in. And as soon as we get that information, we'll share it with the public. So we are still working on that, but that would be additional doses of AstraZeneca vaccine. We have been engaging the Russian institutions pertaining to the Sputnik vaccine, and we are working to get some Sputnik vaccines directly from them. Those discussions are ongoing. We were expecting to receive the first 5,000 doses from them, and we're still working out the logistics to get that from Moscow to Guyana. In addition to that, we have put in a purchase order for 200,000 doses of the Sputnik vaccine, and within a 2-week period, we should have the first 50,000 doses arriving in Guyana.
A final question, and this is from NCN. Could you respond to the leaked paperwork all over social media showing that there are drug shortages at the Linden Hospital complex and GPHC?
Well, I haven't seen any leaked paper. Maybe I'm not on the same social media, but we do have issues with some medications being short, and that's a problem that we have inherited, and I've spoken about this in the Parliament. And what has compounded the problem is that one, drugs weren't ordered for many years. Two, you had a problem where in the bond itself there were lots of expired drugs, and we just conducted audit, and we have to dump. We already dumped close to $1 billion Guyana dollars of expired drugs, and we have to dump some more. So how they were procuring and what they were procuring, led to all kinds of complications. We are now trying to fix that situation. Late last year, we bought 2 months of supplies where we are trying to replenish some of the medicines that are short. We have started receiving those medicines that we have purchased late last year, and as we get them, we are sending them out to the different institutions, Linden included, Georgetown Hospital, and so forth. We have another order for 4 months of supply that was opened about a week ago, and once it goes through all the process of being evaluated and awarded, we'll give that to whoever win the bids, and hopefully we'll start getting from that supply as well. And then we have a larger bid, which would be for 8 months or so. So once all these medicines start coming in, whatever shortages we have, we'll alleviate them, and then Our intention is to keep buying so that we can replenish before we run short. But we have to stabilize the situation now, and that was why we went to get the emergency order late last year. So it is a big problem that we have inherited. We haven't been able to correct all of it as yet, but we have corrected a substantial part of it. But you can imagine that in the health sector, we literally buy hundreds of different types of drugs. And therefore, to make sure that we have all of them in stock with the right amounts and to get them out into the region, it can be challenging sometimes. But we are working on it, and I can assure you that we'll stabilize the situation.
All right, Minister Anthony, thank you very much for joining us today, and we wish you a safe and wonderful weekend. And to you, our viewers, as well, thank you very much for joining us. Do have a safe and wonderful weekend, and remember to follow all COVID-19 guidelines. For more updates and other stories, you can visit our website at dpi.gov.gy and our social media pages, Facebook and Instagram at DPI Guyana. Thank you. Goodbye.